Okay, thanks. So we have somebody else at the microphone, and we're going to transition this to a general open discussion. So introduce yourselves, and if you have a particular person you'd like the question to be targeted to, please mention that.
I'm Christina Rather from the other NIH, from Bethesda. And this previous talk was just beautiful and raises a lot of questions. One of them, and this goes probably to several speakers, do you take socioeconomic status into account, and do you see clustering? We've seen the maps in Europe. There are certain clusters where we see more exposure than in other regions. How about socioeconomic status? Is there more clustering? And then if I may just make one comment, especially to the clock gene information that we've just received, I would also like to propose that there may be a greater vulnerability of being exposed to these obesogens depending on the circadian rhythm. So it depends when you're exposed, what effect you will see. So not saying the other way is not, we saw beautiful data, but just proposing that there may be something that one should look at too. So but the question with the SES is, do we see clustering?
Juliette, did you have a response to that? And then we'll go to Frank.
Yeah, so to answer first about the socioeconomic analysis, that is a very good point, and we, our epidemiologists on the team certainly saw differences and corrected or used socioeconomic class as a covariate in their models, that's for sure. And one particular interesting socioeconomic observation is in our Slovak, our Eastern European cohort. They're made, I think about 2/3 of the cohort are of Roma origin, which would say rather would be like gypsy origin, would be a very specific socioeconomic class. And we saw the highest effects on obesity in this class, but also the highest exposure levels. Mm-hmm. So indeed, that's a really important factor that we've included in our analyses.
Okay, thanks.
And regarding the circadian rhythm question, I'm afraid I didn't hear you well enough to actually understand your question. Is it possible to repeat that, or can we get back to that?
Sure, she's coming back to the
running to the microphone. The question was, would you consider it a possibility that the time of exposure has an influence on the effect, which means when the exposure happens with regard to the circadian rhythm. So we know insulin has a circadian rhythm, and if I eat something, I get a higher insulin response in the morning than in the evening. And the same thing I'm proposing could happen with an obesogen, with a pollutant, that if you're exposed during, for example, the night, you have a different effect because it's the circadian rhythm of leptin or other adipogens than in the afternoon or evening.
Oh, that's a really interesting question. That's really interesting. We have not looked in that way. We expose the animals continuously throughout the 24-hour cycle. So indeed, we may have masked a specific daytime or nighttime related effect. That's really interesting. What we did do is, I thought your question might go along the lines of the stage of development, of course, is also really important in how the circadian rhythm is actually developed. We see in our fish that it isn't until a certain stage of development that they actually have this this wavy cycle that develops. So that means that there must be a certain brain development, certain development of the pineal gland, etc., to actually register this clock gene expression. So I can imagine that would also influence, the chemical exposure could also influence the development of a proper circadian system, depending on when you do the exposure.
Okay, thank you. Frank, you wanted to add to this?
So the question about socioeconomic status, and the others have come up about the possible interaction with race and ethnicity with SES. So our study has examined the built environment. We've also tried to better understand how the factors of SES as well as race and ethnicity interact with both the complex cultural and genetic background as well as what is the environment around them. So we've collected the data. Again, this is just as complicated as sort of assessing all the different exposures that one has, and I think maybe that's a good parallel between the two. You know, SES is more than race, race is more than SES. There's a complex interaction, but there's also some of the cultural heritage as well as the specific environment that they live in, and I think they all interact with each other, sometimes difficult to tease apart.
Thank you. Erin, do you have a question from the web?
I do, yes. So this is from one of our speakers who wasn't able to make it in person today, but's watching the webcast. It's Judy LeKind. So she asks if the models for postnatal exposure and BMI took into account the differential between breastfed children that often have a lower growth rate compared to formula-fed children. And asking that presumably the higher postnatal exposures reflect both in utero exposures, but also may account with differences in breastfeeding versus formula feeding.
Okay, who would like to tackle that?
Well,
Go ahead, Juliette.
yeah, maybe I should. What an excellent question. Yeah, so you know the interesting thing about all of these women who participated in our European study is that they all breastfeed. So there were only one or two mothers in the 2,000 that participated that didn't breastfeed. So we couldn't distinguish between formula-fed versus breastfed children. And I know the main author on this study has commented that in her paper, which should be out any day now in EHP. So we could only distinguish between duration of breastfeeding and not between bottle-fed or formula-fed versus breastfed. And I'm sure there's a difference. There could be a difference there as well. So that's a really good question.
Thanks.
And I think the second question, if I remember correctly, was dealing with, you know, if the breastfeeding exposure also takes into account the in utero exposure, that you really can't separate the two. Is that the gist of the question?
Yes, it is.
Yeah, I think that's also very true, very true. And our scientists working on this study clearly showed that there is a collinearity between the prenatal exposure and the postnatal exposure. You can't completely separate the two. But I think the important point we wanted to make here is you also cannot neglect how important postnatal exposure is in some of these, for some of these exposures, certainly for women who have a longer breastfeeding duration.
Okay, Frank, I think you want to add to the discussion? Oh, Danny's had yours now? Okay, so we'll give you both time to answer.
I just wanted to add that in relation to the question about breastfeeding, in both the INMA and the Faroes projects, we have quite detailed information about duration of breastfeeding and also time of introduction of solid foods and whether the children were receiving formula milk or not. So we have constructed a variable that combines this information and reflects the duration of exclusive breastfeeding. And when you adjust for breastfeeding duration or exclusive breastfeeding duration, in either cases you see some attenuation in the effect estimates, but this did not completely rule out the effects that we see. So, I mean, we are controlling for breastfeeding and we don't see much going on there.
Thank you, Frank.
So I then have a question that sort of begs to be asked. Have people looked at birth order? A lot of these agents are lipophilic, and that one would consider that perhaps the firstborn who's breastfed might have a much higher exposure than those that are born subsequently. Because unless there's a really high exposure to the mother after that firstborn, it is going to be that firstborn that's going to be born. I'm just struck by several years at a conference here at NIHS that somebody discussed what happened to firstborn orcas. and what the cause of that was.
Yeah. Our models are also controlled for birth order. That's a very interesting comment, because indeed we see differences in the level of exposures in the firstborn compared to. So some studies have notified that. So it's an interesting consideration.
Okay.
Yeah.
Thank you. Next question in the back here.
Sandra Haslam, Michigan State University. I had a question to Juliette about the animal studies. I noticed, or I think I noticed, that in those studies you do a high-fat diet challenge. Is that correct?
Yes, that's correct.
And so, which I was wondering whether if you just had a chow diet, would you see changes in body weight? And then that also then leads to the question of, are you looking at dietary information in the human studies that you're doing?
Okay, thank you for that question. Actually, hello?
Yeah.
Is everybody? Am
We can
I
hear
on
you.
the line still?
Yes, you are.
Okay. I see the person who just asked me the question. I guess there's a delay in what I'm seeing and
Yes,
what you're
there is
hearing.
a few minutes delay, few seconds delay.
Sorry, so I wasn't sure if I just interrupted her terribly. But no, a very nice question. We did not see significant effects on body weight, with the exception of bisphenol A in males, on the normal chow diet, which is why in 4 of our 5 animal studies, so for PFOA, phthalates, PCB 153, and dioxin, we all gave the animals a high-fat challenge at the end of the follow-up period, because we did not see any effects on body weight changes on the regular chow diet. So that's the reason why we added that. In the bisphenol A exposed animals, in the males, we did see an increase in body weight on the normal chow diet right from early development on. In males only, by the way. So the other question was, how did we look at diet in our cohort studies? Well, we tried the best we could. I think I've heard a previous speaker talking about the limitations of food frequency questionnaires. That's what we had, and we had some information on the type of fats the mothers were eating during pregnancy, and we tried to see whether or not, for example, high fish consumption could play a role in the effects we saw in the children, but we did not see that. And that's about all the information on diet we had, unfortunately. We had no information on childhood diets, and I think that's a big limitation of our study.
Okay, thank you. Okay, we have another question in the back here.
Sally Darney from EPA. I noticed in Dr. Valvi's talk that there seemed to be a higher prevalence of obesity in the southern European countries to begin with. And then in the U.S. charts that CDC has presented, the Southeast seems to be an area where obesity has been of a larger increase. And I wonder if you or anyone has considered the role of either latitude or climate, appreciating that this could affect possibly metabolism, growing up in a cold climate versus warm, or certainly could affect exposures, agricultural regions versus industrial regions, and so on. I just wondered if this should at some point be considered.
That's an interesting comment. Yeah, we have not accounted for that. But in terms of chemical exposures, we have collaborated with other European projects that have measured other environmental cohorts that have measured similar chemicals, and we have analyzed jointly our data, and the direction of the associations go more or less in the same direction. So I don't think that, at least for the associations between chemicals and obesity, there is some weird confounding because of the geographical latitude. Or in cases that we detect different associations, I would I would be more concerned about genetic variants or other very important causes for obesity, like differences in diet between the Nordic and the southern countries, or the physical activity, perhaps. But yeah, that's interesting, because now we have enough data that they show that climate conditions, for example, influence birth weight, and birth weight is an important determinant for obesity later in life, and also it's an important predictor for other health effects. So it's possible to be a relationship between climate or universe and geographical latitude and obesity. It's an interesting comment.
Thank you.
Thanks.
You're welcome.
One more question in the back here.
Hi, I'm Archana Lamichani from UNC Chapel Hill. Thank you for this great presentation. I enjoyed it. And one of the questions I have is related to gestational diabetes. So I don't know if that's an issue in the population you are looking at. And you guys talked about the impact of influence of exposure to these chemical contaminants and leading to lower birth weight. But if you can comment a little bit on exposure to gestational diabetes in utero and how that can lead to higher birth weight and again leading to higher obesity and other metabolic diseases over time, that'd be great. Thank you.
Yeah. Gestational diabetes. That's my the reason that I'm losing my sleep lately, because in the Faro cohorts, in the Faro cohorts we have now quite a lot of data on diabetes during pregnancy, and we have measured some insulin tolerance biomarkers later in the children at puberty. So for some of the chemicals, for example, PCBs, and also now there are more and more studies suggesting perfluoroalkyl or alkyl compounds like PFOS and PFOA may increase the risk for diabetes. And if prenatal exposure can increase the risk during postnatal life, why would not exposure in the mother increase the risk for diabetes appearance during pregnancy? No? So that's a possible scenario, and it could be that gestational diabetes mediates some of the effects that we see between prenatal chemical exposures and childhood obesity. That could be one scenario. The other, it could be that it's a confounder, because diabetes during pregnancy could change the metabolism of chemicals, and this may be the reason why we see associations with obesity later in life. I'm not sure about the direction of the associations in this, let's say, causal diagram, no, yet. So I'm not sure if we should study gestational diabetes as a mediator or as a confounder, and we can do more work on that. But you are right. It's an important component to consider in our analysis.
Thank you.
Okay, thank you. I think we have another question from the web.
Yes. So this question is from Sanjita Kari with FDA. And the question is, do the speakers have any opinion on the method of delivery, and that would be cesarean versus natural vaginal birth, in terms of microbiome exposure and then the effect on obesity?
These are too many questions in one.
Oh. That's interesting.
Type of delivery, sure. A very important, interesting, I would say, variable, because there are studies that have associated with later metabolic risk. There is also an association with birth weight. So It's something of interest to test in both. Well, in the INMA study, we have information on type of delivery. I always adjust, train my models. I adjust my models for these covariates to see if the associations change, and I never see any effect. I would say, because type of delivery is something that you can easily measure. You extract this information from the medical record, or even if you ask the mothers, they report it quite accurately. So I don't think that it's measurement error, the fact that we don't see any influence in the relationship between chemicals and obesity.
Frank.
So I'm going to
I'd like to add something to that, if possible. I'm not entirely sure that the type of delivery doesn't affect the type of exposure of the child, and that's a study I'm working on right now with a pediatrician in a Dutch hospital, where we're comparing levels of bisphenol A and phthalates in the different types of delivery situations. And this is a neonatologist, actually, who works with these premature babies who are born in a situation where they're right away put on all sorts of apparatus, breathing apparatus, intubation, intravenous tubing. And what we're very interested in is looking at if there are any differences in that in a peak exposure right there at birth, compared to delivery in a normal operating theater, compared to the favorite Dutch way of giving birth, and that's in the home. So I'm wondering if maybe in a little while we might have some information to show that there may be quite a different early exposure to some types of chemicals that we should keep in mind.
Yeah.
Thank you. Go ahead.
Yeah, I'm glad that you clarified this, because I was replying in the question thinking about persistent chemicals, because I presented earlier today persistent organic pollutants, and I'm now working also with PFCs and all that, which is a kind different type of exposure, in sense that these are persistent chemicals. You measure it once. It may be in the first trimester of pregnancy, the third, or in cord blood, and more or less you find correlated. The measurements are quite correlated. Now, if we start to talk about the influence of type of delivery in non-persistent chemicals, then I'm afraid I don't have a very clear answer about that, because it would depend very much on the time of the pregnancy that we have measured the chemicals, and on how accurate our measurements are. For example, because I have worked with phthalates before in INMA, we measured it twice using two urine spot samples. One was collected in the first trimester, and one was collected in the third trimester. So I'm not sure if these two measurements are enough, can accurately classify exposure in our women's in that a good way, so that we would be able to see differences in exposure levels between women that a few weeks or few months later have delivered with cesarean or naturally. I mean, I don't see any difference in the levels of exposure, but the time window that we have measured exposure may be not at all biologically relevant for what is going on at the time of birth. Is this clear now?
Very clear.
Yeah.
Thanks. Frank, did you want to add?
I'm just going to put my clinician hat on. I got to use my line, I'm just a simple country doc now. But I think that's a number of different confounding agents here, because there's going to be different rates of C-sections across different parts of the world, so who comes to C-section? There's going to be, in those who do come to C-section, there's going to be different reasons for why they come to C-section, and some may be, preterm delivery or failure to advance, could be confounded with type 2 diabetes as well, because a lot of infants of diabetic mothers are born by C-sections because of macrosomia. So I think that if one's going to look at a study, and then all the sampling that would be done are IV fluids that would be administered to the mother, and therefore the influx of phthalates at that time. I think that if one's going to do this study, it's going to have to be a very well thought out study, whether it's the first C-section, repeat C-section, what the reasons are for the C-sections, because there's so many different things that could be impacting this. I mean, these are all important points, and just thinking about an SGA infant that's born prematurely is going to have a huge burden of phthalates in the first couple weeks of life, because that child is going to be hooked up to a ventilator as well as IV tubing. So I think it's an important question, but one that needs to be done very thoughtfully.
Yeah, that's a very interesting comment.
Okay, we have one more question in the back.
I'm Songkyun Park from University of Michigan, and I want to ask about role of obesity. So we all talk about the negative impact of obesity, but on the other hand, adipocyte can sequester this the toxic chemical, and even the reduced potential toxic effect of this the endocrine disrupting chemical. So in your study, have you thought about that, or in terms of this like a later life disease? So my understanding is that this childhood obesity might be still very early. It's not late, and maybe this type of early getting more adipocyte eventually prevent this toxic effect in much later life in terms of this diabetes or other cardiovascular disease. So maybe the animal study might be the right result that can provide that answer right now, but not from the human study. But have you thought about that as a potential positive impact of obesity?
Okay, so a complex question. I've seen it printed that the adipocyte was one of the major mechanisms for our evolutionary success, and that the adipocyte could regulate metabolism, could regulate sort of how we, putting in a reserve for food, and type 2 diabetes was indeed a mechanism that was adaptable, because if you missed getting that mastodon the one day, you would have a source of energy available to you the following day. And so if you think about our evolution, we live in space-age time, but we still have Stone Age genes. And I think that the point is well made that I did not come up with that term. I wish I would have. But if you think about it, our genetic, except for methylation changes, our genetic underpinning is really that of the caveman and what was successful at that time. It's only been with the advent of 2 yellow structures over our landscape that you can purchase 500 calories for about 27 cents. We're polluting the fat cell. So I agree with you. I think the fat cell has been a good thing. It's received a bad rap. But, a nice, thin fat cell is something that's pumping out and regulating metabolism the way that's supposed to be. But a fat cell that's sort of bursting at the seams becomes a dysregulated fat cell and leads to all the metabolic consequences of obesity. So I do agree with your term.
So I want to add something to your question, too. I think, the concept of sequestering all of our pollutants in a single cell and keeping it there for our whole lifetime to protect us from circulating pollutants is not a concept that's related to how we live our lives. So we're growing, we're changing, we're dieting. How many times have we all been on diets over our lifetime? So we don't know enough about how the pollutants in our bloodstream change with weight gain, weight loss. We at one point in time were interested in folks who had bariatric surgeries to see if, in fact, circulating levels of these chemicals changed because of rapid and very large weight losses. So there's a lot of dynamics related to the pollutant load and the weight gain that I think is still out there to be an important part of the research agenda. Okay, any more questions? Does anybody on the web have any last questions or comments? Okay, I guess then we can have more time for lunch. I don't know